Hi everyone, today we are addressing the loneliness epidemic. We know the data is heavy. We know there is a massive unmet need for care right here in the Bay Area. And we know that the post COVID world has fundamentally disrupted how we learn to socialize as adults. But we don't want this presentation to just be a list of problems. We want to talk about the change. Loneliness often traps us in a paradox where we feel isolated even when we are not physically alone. The change we are proposing today is a shift in mindset. It is about stopping the wait for connection to come to us and instead learning how to be proactive in the world. We are here to explore how we can take agency over our social health and break the cycle of withdrawal. So, we have just established why we are here today. Loneliness is a major public health crisis, and it is an urgent local issue for young adults in the Bay Area, especially after the pandemic fundamentally disrupted adult socialization. On this slide, you can see our roadmap for the rest of the presentation. We are now moving from defining the problem to proposing the solution. We will start by quickly covering the clinical impacts of loneliness to understand the stakes. Then we'll discuss the new social landscape and introduce a helpful framework for building connections. A core part of any successful intervention is personalization. So we will explore how to tailor strategies for both introvert and extrovert. The link between loneliness and depression is not just anecdotal. It is a well established clinical finding. Loneliness is defined as a specific risk factor for depressive symptoms. A longitudinal study with young adults found a significant correlation between loneliness and depression. Loneliness, depression, and anxiety are often interconnected and share shared underlying cognitive and behavioral mechanisms. A key mechanism is social withdrawal. This creates a dangerous feedback loop. Feeling lonely makes you sensitive to perceived threats, which causes you to withdraw, which increases your objective social isolation. A 2024 study confirmed this, finding the link to depression strengthens as isolation becomes prolonged. The impact is comprehensive. For young people, loneliness is associated with poor physical health, poor mental health, and even poor educational outcomes. It's not just a passing feeling, it's a state that can affect your quality of life and prognosis. And it is even considered a prodromal symptom for several psychiatric disorders. This is the key to understand the solution. The most effective intervention for loneliness are not just about creating opportunities for social contact. A major meta-analysis found the most successful strategy is one that addresses maladaptive social cognition. The cycle of automatic negative thoughts, fear of rejection, and distorted beliefs about social situations that reinforces loneliness.
There have been many studies about interventions to overcome loneliness. One meta-analysis provided lots of insight about the different approaches. Let's start with the one focusing on social skill training. This is about providing instruction on social skills such as effective communication. The second type focuses on emotional and social support. This is about providing regular social interaction. The third type focuses on developing hobbies and new activities. This fosters purpose and flow, encourages social interaction through shared interests, and creates a bridge to community and belonging. The fourth type is about social cognitive training. This is about helping people understand, interpret, and respond to social information more effectively. These different kinds of interventions can be delivered through group or individual setting and with or without technology. The meta-analysis found While there is evidence for effectiveness, these interventions have important limitations. So it came up with multiple recommendations, such as we need to design interventions specifically for loneliness, and we need to target both transient and chronic loneliness. Also, we should consider broader risk factors such as socioeconomic status and health context. In 2024, there was a Harvard YouGov survey on loneliness. It proposed solutions at multiple levels. At the individual level, one can make the effort to connect with family and friends, practice self-compassion and forgiveness, and engage in acts of service by volunteering. At a community level, we can encourage collective service as a way to build meaningful connections and purpose. This will help foster a culture of care and service. We also need to create social infrastructure, such as public spaces and community-oriented fun events. Finally, we need to support housing and transport policies that reduce isolation.
I'm going to be covering some of the emotional and social impacts that came along with COVID. One of the main themes that came up was that even with the access to technology, students reported feeling cut off from their peers, teachers, and the school environment as a whole. According to a 2024 study, many students avoided turning on cameras, rarely participated in discussion, and slowly stopped communicating altogether unless it was absolutely required. I definitely experienced that myself. A second major issue was the decline in social emotional skills, especially among younger students, because so much social development happens through casual interactions during the day. The shift to online schooling limited those opportunities immensely. And even though this research focused on education during the pandemic, the authors also pointed out broader parallels. Social withdrawal, difficulty communicating, and decreased emotional regulation are not unique to COVID. They just kind of became magnified in a way that made them impossible to ignore. So what this study really shows is that learning is not just about content or academics, it's relational. And when that relational part is disrupted, it can affect everything from motivation to mental health to identity development. Now that we've looked at how distance learning affected connection and skills, it's worth talking about the mental health impact and where we can go from here. During the pandemic, nearly half of college students reported experiencing significant stress and worry, according to a 2023 study. That wasn't just about school, it was about the isolation, uncertainty, and lack of real human connect. That was also found in the Liu and Lin, that reduced emotional connection led to higher rates of anxiety, depression, and burnout. It wasn't just a stressful semester for a lot of students, it was a genuine mental health crisis. Because of that, moving forward has to be intentional. Rebuilding campus community through peer events and support groups is a big piece of the recovery process. Students need a place to reconnect and feel like they belong. We also need to expand access to counseling and mental health resources so it helps it be accessible to everyone and not like an extra hurdle or something to be avoided. Encouraging this balance through stress management and wellness programs is another priority. Those individual strategies can be super beneficial. The goal isn't just to return to normal, it's about building a healthier, more connected environment than what was disrupted previously.
Congratulations! We are now about to start your extrovert versus introvert quiz. Here are the rules. There are 4 questions. Remember your letters, and you just need to choose one. Are you ready? Let's go. Let's start here. On your free time on the weekends, do you prefer A, mingling at a party filled with people you've never met before, or B, sharing a deep conversation with one person? Number 2, the people who know you the best are most likely to describe you as someone who is A, quiet and reflective, or B, outgoing and talkative. Number 3, I like to celebrate my birthday with my friends in A, a small group setting, of 3 to 5 people. Or B, let's throw a big bash, 10 to 20 people. Last question, number 4. What's your best idea of fun? Is it A, staying home and binging on Netflix? Or B, a nightlife with a group of your friends? Time to count your points. Here are your results. If you're mostly A, congratulations, you're an introvert. That means you recharge alone. You're quiet and reserved. Prefers a quiet setting. Thinks before acting. Very independent worker. And socializing can be very tiring. If you're mostly B, congratulations, you are an extrovert, which means you recharge with people, outgoing and social, enjoys big gatherings, decides quickly, is a team player, and socializing is very energizing for you. Thank you for playing.
Now that you got your result, we have some activities recommended to you based on whether you believe you are leaning towards more as an extrovert or an introvert. Since this video is targeted towards young adults living in the Bay Area, we want to introduce a page called the SF Station. It recommends different type of events at different dates and time. The section can be separated towards family and children, dating, or community focus. And they also listed out the price for each event for the user to decide what event they want to join. But it is also important to remember that whether you are an introvert or extrovert, it doesn't mean that you only enjoy a certain activity. And a lot of time is the amount of interaction or socialization that determines how an individual decides the frequency or the way to interact with each other for different activities. So for many activities that we suggested here can be turned into a single person activity or group activity based on your preference. And here are some general activity we recommend to extroverts. Since there are many mountains and natural habitats around Bay Area, having a hiking or a camping group could be fun for extroverts who love the nature. In some community or in the city activity can be like going to museum with interactive element, joining choir or orchestra or community service activities. And for indoor activities for extroverts can be like collaborative crafting with friends, unlike games that requires the multiplayer function, or joining a remote watch party or book club with close friend or through an online platform. For introverts, it doesn't mean that one dislikes socializing or interacting with others. So here we suggest some activities that can be easier to manage the amount of socializing one would like to have. So for outdoor activities, such as going to museum or exhibition, running, cafe hopping, going on long walks, jogging or running could be easier to manage. As for indoors, we suggest the crafting that includes crocheting or knitting, reading, writing, journaling, or gaming with games that only have single-player function. And even though for indoors sounds more like a solitary activity, you can still find communities in real life or online spaces to share and connect with others. And here are our references for this presentation. Thank you for watching.